Yes.
Thank you, Mayor, and thank you, WDC Manager Anderson, for the update. So, we just heard from Dr. Engelthaler that, there's a lot that is in the pipeline heading our way. And we also obviously heard that this variant isn't likely going to increase death rate. But I'm just wondering, from the perspective of council meetings, in-person meetings, our staff, et cetera, is the city internally working on a plan to get us through the next 2-month window of time, or month and a half window of time? I'm guessing this data is maybe also somewhat maybe new to our team as well. And I just want to make sure we're prepared for what's yet to come, and maybe not supporting the spread, but also, doing our duty. Maybe those plastic dividers between council members that do attend might be of benefit to the group. And I'm just wondering, have we had any of those discussions?
So Councilmember Shimoni, the city has remained in phase 3 of our reentry plan, which means that we're still limited opening, limited services in our city facilities. And just as recent as this last Monday, just continuing to remind staff to be able to work remotely in the cases where that is, that's available to them, and that it works to provide the service virtually. So we are continuing to do that in order to reduce the number of staff as well as visitors in our buildings. And we do require that individuals wear masks while inside our facilities as well as our vehicles. So I think our continuing of those requirements should help us in getting through the next, I think you had indicated the next 30 days.
Okay. Yeah, 30 to 45 days is what Dr. Ingenthaler was expecting the timeline to be. And then, with his comments regarding the type of mask and N95s fitted well, Mayor, I personally would recommend that we go back to a fully virtual reality, as to get through this period of time, and also maybe not ask our staff to meet folks in person unless it's like outdoors with masks on. Shannon, I trust your leadership and concern for staff's needs, but I'll just speak from, a member of council here. I'm very concerned about what's to come, and I know that it's not going to, potentially increase our death rate, but it might knock out our ability to operate in certain ways. And so that's likely going to happen. We're going to expect to see these numbers triple, if not, even more potentially in the next 2-3 weeks. So yeah, I guess those are my comments, Mayor. I know that this is our agenda item to talk about it. So council, if you do have any thoughts, I'd love to hear what you're thinking. But yeah, I'm concerned. Thank you.
Thank you, Councilmember Shimoni. Any other comments, questions? All right, I think, well, in regards to the proposal for Councilmember Shimoni saying that we should potentially go virtual, I think we're seeing here today I think that us as council members have been very responsible regarding our contacts, and we're all vaccinated. And just like you're staying home today, last week I stayed home because I had a known contact. So I do trust in my fellow council members, at least up here at the dais, that we are acting responsibly with this hybrid model. I would just encourage messaging to staff, et cetera, that similarly, if they got a scratch in the back of their throat, to please get tested, take some additional measures, stay home, whatever is required, and let's. I trust in the responsibility of us to be able to navigate that at the staff and elected level. With that being said, though, we may want to really start looking into the opportunity potentially for the city itself to be able to provide tests to its staff members. We've been having a rather large shortage. So many people couldn't find them at Walgreens or anywhere else during the holidays. They're still having difficulties. I know we're getting more of a shipment in from CCHHS with the state here soon, which I'm glad is going to be more available to us more generally, but in terms of as an organizational standpoint, it would be good if we could have a stock to supply to our employees in case they do have symptoms, just to be sure we're protecting our people here in the organization. So just a thought on that front. All right, aside from that, I do believe